Hey guys, and welcome to How to Gastro. So in today's video, we'll be exploring what is a D-dimer or cross-linked fibrin degradation products blood test. So let's get started. So before we get into the specifics of the D-dimer test itself, let's talk a little bit about what you can expect when your doctor orders this test for you. So a D-dimer blood test, also commonly known as a cross-linked fibrin degradation products blood test or XDP blood test, is a simple test that can be done at your closest laboratory or hospital. So no special preparation is needed for the D-dimer blood test, which means you don't have to fast, so you can eat and drink as usual before the test is done. During the test, a blood sample will be collected from you, which means a needle will be inserted into a vein, usually in your arm, to draw out some blood into a blue top or citrate blood tube. This blood is then sent to a laboratory where it is analyzed and resulted. So now that we know what you can expect during the testing process, let's talk a little bit about what exactly is a D-dimer blood test. So the D-dimer blood test is a diagnostic tool used to measure the presence of D-dimer in the blood. So when blood clots form in the body, they are stabilized by cross-linked fibrin, a protein that holds the clot together. So if we just pause and take a look at this image at the bottom of my screen, we can see what these cross-linked fibrin proteins look like. And this is here pictured in blue. So the body eventually breaks down the clot in a process called fibrinolysis. So here we have a clot that's formed in the body, and then we have the breaking down of this clot during the process of fibrinolysis. As the clot is broken down by the body's fibrinolytic system, cross-linked fibrin degradation products are released into the bloodstream. So now as we see the process of that clot being broken down, we have these cross-linked fibrin degradation products that are released into the bloodstream, and this is actually called D-dimer. So D-dimer is a specific type of cross-linked fibrin degradation products and is a small protein fragment that is produced when the blood clot dissolves in the body. So here we see what the D-dimer actually is. So if the blood test detects elevated levels of D-dimer, it may indicate the presence of an abnormal or significant clotting process in the body. So what this D-dimer actually points us towards is the formation of a clot process in the body and the degradation or the breaking down of that clot through the process of fibrinolysis. So now that we know what the D-dimer blood test is, let's explore why doctors may order this blood test for you. So doctors order a D-dimer blood test primarily to help diagnose or rule out conditions associated with abnormal blood clotting. So here are some of the main reasons why this test is commonly ordered. So number one, we have to rule out thromboembolic disorders. And under this category, we have three major subcategories, which are DVTs or deep vein thrombosis, PEs or pulmonary embolisms, and strokes. So let's explore each of them a little further. So DVT is a condition where blood clots form in deep veins, typically in the legs. So symptoms here might include swelling, pain, and redness in the affected limb. And a D-dimer test here can help rule out DVT if the clinical suspicion is low. Then we have pulmonary embolisms. So pulmonary embolisms occur when a clot travels to the lungs, causing chest pain, shortness of breath, and potentially life-threatening complications. So here, a normal D-dimer result can help exclude the diagnosis of pulmonary embolism in low-risk patients. And the third subcategory here are strokes. So although D-dimer is not a primary diagnostic tool for stroke, the D-dimer test can be part of the assessment when a stroke is suspected to be caused by a clot. So to basically sum up this slide, the D-dimer test is usually ordered when we have suspicions of thromboembolic disorders or events in the body. So the most common ones here are the DVTs, the pulmonary embolisms, and strokes. So a normal level of D-dimer will usually point us away from a thromboembolic disorder, but high levels or raised levels will point us towards a thromboembolic disorder, such as the ones listed here. So continuing with reasons why doctors may order a D-dimer blood test. At number 2, we have to evaluate disseminated intravascular coagulation, or DIC. So DIC is a severe condition where widespread clotting occurs throughout the body's bloodstream, followed by excessive bleeding due to the depletion of clotting factors. So a D-dimer test here can be very helpful in monitoring the extent of fibrinolysis in disseminated intravascular coagulation. At number 3, we have to monitor anticoagulant therapy. So doctors may order this D-dimer blood test for patients on anticoagulant therapy, for example, for treatment for DVTs or pulmonary embolisms. So here, the D-dimer test can be used to monitor the effectiveness of the treatment, and if D-dimer levels decrease, it can indicate that therapy is working to reduce clot formation in the body. Coming in at number 4, we have post-surgical or post-trauma evaluation. So after major surgery or trauma, patients are at increased risk of developing blood clots. So here, the D-dimer test can assess whether there is an ongoing clot formation, particularly in patients who develop symptoms like chest pain or leg swelling. So continuing with reasons why doctors may order a D-dimer blood test. At number 5, we have the exclusion of blood clotting disorders in pregnant women. So pregnancy increases the risk of blood clots forming in the body, and if a pregnant woman presents with symptoms suggestive of DVT or a pulmonary embolism, a D-dimer test here might be ordered. So an important point to note here, however, is that D-dimer levels are naturally elevated during pregnancy, so the test must be interpreted with caution. At number 6, we have the evaluation of unexplained symptoms. So when a patient presents to the ER with unexplained symptoms like sudden shortness of breath, chest pain, leg pain, or swelling, a D-dimer test here may be ordered as part of a broader diagnostic workup to rule out clotting disorders. And finally, at number 7, we have cancer-related clotting risk. So certain cancers can increase the risk of clotting in the body. So in these cases, a D-dimer test may be used to monitor for clot formation or to investigate any symptoms suggestive of a recent thromboembolic event. And so these are the basic reasons why doctors may order this D-dimer blood test. So moving along, let's speak a little bit about the normal ranges of D-dimer in the blood. So a normal D-dimer result is considered less than 0.5 milligrams per liter of blood. So how do we interpret these results? So normal or low D-dimer means that the result is within the normal range and typically suggests that it's unlikely that the patient has had an acute clotting disorder like DVT or pulmonary embolism. However, in elevated D-dimer results, so here we have results above the normal range, which may indicate the presence of abnormal clotting and warrant further investigation. Though it's important to note that the test is nonspecific and can be elevated in various other conditions, such as inflammation, infection, trauma, or recent surgery as well. So an important point to note about the D-dimer test is that it can be elevated in various conditions, not just in thromboembolic events. So yes, it is very useful to point us towards a DVT, a pulmonary embolism, a stroke, or DIC, but it can also be elevated in other conditions like inflammation, infection in the body, recent trauma, or recent surgery, and as we explored earlier, in pregnancy as well. Therefore, it is known as a non-specific blood test and therefore needs to be used clinically together with other further investigations to ensure a proper diagnosis is established for the patient. So the take-home message. So the D-dimer blood test is a useful tool for ruling out thromboembolic disorders in patients with symptoms that suggest clot formation in the body. A positive D-dimer result can tell doctors whether a person may have blood clots somewhere in the body, and it is especially valuable because a normal result can often exclude the presence of serine clotting conditions, allowing doctors to avoid more invasive and more expensive testing in many cases. However, due to the test's non-specificity, it is typically used in conjunction with other clinical assessments and diagnostic tests. And that brings us to the end of this video. So thank you guys so much for watching. I hope you found this presentation very interesting and informative. Please make sure to like, comment, subscribe, and share this video with some of your friends in the medical community. So I've also just signed up for Buy Me a Coffee. So if you want to encourage me to do even more, or to say thanks for all the free information you've received on my channel today, you can click down in the description box below to buy me a coffee. So take care and have a wonderful day further. Bye for now.